Hello, and welcome to the DiaSorin Live at ADLM podcast. Thank you for joining. We're live in Anaheim, California for ADLM, where great minds meet. I'm Michelle Kaplan, Senior Marketing Manager at DiaSorin, and I'll be moderating our discussion. Today we'll be discussing the impact of tuberculosis, or TB, in the U.S. with the aim of providing a few interesting stories to shine a light on the burden TB brings to the U.S., as TB infections likely happen more often than you realize. I'm joined by Doreen Williams, the North American Nurse Manager for QIAGEN. Doreen holds a BSN and Master of Health Leadership degree and brings a wealth of practical knowledge about TB. She is a sought-after voice in the field with a passion for empowering healthcare personnel in the fight against tuberculosis. Doreen, thank you for joining us.
Thank you for having me, Michelle. I'm very excited to be here.
Excellent. Could we start off with having you tell us a little about yourself?
Of course. So I am a registered nurse. I started bedside, like most nurses do, got into administration, and then started consulting. I will be honest, when I came to work for QIAGEN, I knew about 10 minutes worth of tuberculosis. And very quickly, once I started learning more about it and really listening to patient stories and hearing about the impact on families, I became extremely passionate about fighting for our patients and really helping to cure this disease.
Wonderful. Thank you. So to that end, I'd love to learn a little more background on TB in the U.S. and specifically how it likely impacts many more individuals, families, and communities than a lot of us are probably aware of.
Yeah, exactly. As I had mentioned, I even as a nurse, I was unaware of the impact. And a lot of people we meet today, they say, "Oh, is TB really still a thing? It's been around for thousands of years." And the answer is yes, it really still is a thing. And so I thought maybe we could start with just level setting a little bit. There are two types of tuberculosis. One is called latent TB or TB infection, and that is the silent part of TB. The patient is asymptomatic, not contagious, usually feels just fine. And then we have what's called active TB or TB disease. And that's when we think about TB, that's generally what we think about. We have some symptoms: wheezing, night sweats, coughing, weight loss. That person is contagious. It is an airborne disease. So that's what we're trying to do with QuantiFERON and with testing, is to prevent that active state. And then just to give you some concept around the impact that TB is having, globally, there's about almost 11 million people that have TB disease. And there's about a little over 1 million, 1.2 million that die every single year. This is still the most deadly infectious disease in the world. So in the United States, we're very lucky because we have reduced our burden of TB. So we have about 10,000 people with active tuberculosis, but there's still about 13 million with latent TB or TB infection that don't even know they probably have it.
And I just want to recap what you said. So that's in the United States, we have over that many people with latent TB, kind of dormant, not asymptomatic,
Right.
but potentially carriers of the disease.
Absolutely, yeah. And I think where my passion comes from, and probably one of the single most important messages I'd like to get out to people is, to screen for TB and test for it is so simple. The treatment protocol, when we look at treatment, most people think about the treatment for active TB, which is pretty intense and toxic to your liver, and there's a lot of side effects. But the treatment for TB infection is very straightforward. It's two different medications once a week for 12 weeks. In fact, I'll share a funny story. One of my colleagues used to run a TB clinic, and she would have everybody come in on Tuesdays, and they called it TB Tuesdays, and everybody would come in and take their pills and then be gone for the week. And even according to the CDC, if you complete your treatment protocol in 12 weeks, you're technically cured from the infection, and you will not progress to the active state unless you're re-exposed at some point.
Okay. Wonderful. And as we think about this, who would you consider high risk, right? I think a lot of folks, again, like you said, it's a 1,000-year-old disease, right? It doesn't happen here in our backyard. But in the United States in particular, who would you say is high risk for acquiring TB?
Yeah, so we have some really unique populations that we look at for high risk. One of them being anybody that's living in a congregate setting. So think about a prison or jail. our schools. We had an outbreak recently in San Francisco at a local high school. Our homeless shelters, our long-term care facilities, anywhere that we're going to put when we send our kids off to college and we're putting them in that dorm, right? So anywhere there's going to be a group of people living together with sustained interaction, that is what we consider high risk. Also, individually, people that are immunocompromised. So if they're starting a biologic, they are required to test for TB prior to starting that. We also look at and think about our pediatric patients because they haven't built that immune system, so they're not as protected, right, as adults.
Absolutely. Okay. Well, you mentioned one example at a San Francisco high school, but I'd really love to talk through maybe an example of where this has happened and really the impact and how that trickles out. Again, I just want to say it's crazy to think that we have over 10,000 active cases per year of TB in the United States, let alone that latent TB population. Right. No country's immune to the risks of TB, it seems.
Not at all. Yeah. And I kind of liken it to an iceberg. Think about those icebergs you see in the ocean, and you're really just seeing a tip of the iceberg. That's the 10,000 cases that are active, but the 90%, the 13 million that's below the water, that's the TB infection that we have in the United States. So, if you're thinking about it in that perspective, it's like, wow, there's a lot out there, right? So our job is to go get them diagnosed. So I do want to share a story. We recently had the largest outbreak in TB in the United States in Kansas. And it started a little over 2 years ago. In about a 2-year period, they had 67 cases of active TB or TB disease diagnosed and about 80 cases of latent. Now, I can tell you that they're starting to see some conversions. QIAGEN is actually going to be there in August 2nd to help with a screening event. They're going out and doing retesting again, even though it's been active for 2 years. And what's interesting about this case, and I think what's important for people to realize is, you may not live in a congregate setting, or you may not be immunocompromised. But in this particular case, the source case, the original person, the exposures were happening in a church, and they were happening in a factory, and in communities where people were very close-knit and lived together. So you could say, I don't have any risk factors, but if you go to church on Sunday, you could, and I don't mean to scare anybody, I just want to raise awareness, but it is out there, and it is highly contagious.
Wow. And just think of the positivity rates in that community and how it impacts.
Yes. For example, they did a small screening event recently. Well, it's probably been a year now. And they had 55 people. It was a very small community screening, and 53% of them tested positive with QuantiFERON for latent TB.
Wow.
Yeah.
And you also mentioned something similar happening at a San Francisco high school.
Mm-hmm. Yeah. There was a high school case just recently this year that ended up being 6 active cases of tuberculosis, but they shut the high school down for about a week. So, what people need to look at also is not the impact on those individuals and their families, but the impact of the community, right? So now we're looking at those high school students probably went to a pizza parlor. They probably hung out at the movies. They were being active in their community. So just raising awareness about that is really important.
And I want to just differentiate between active and latent, right? Mm-hmm. We think of that latent patient who's taking medication for 12 weeks, right? And then they're cured, versus that patient who moves into active disease, like these students in the San Francisco high school. Can you give us a quick glimpse into what that treatment path looks like for them? Yeah,
so they will start out on a typical generic antibiotic, and then once their culture comes back, so we know what they may or may not be resistant to, then they'll either change medication or change the protocol. But it's very significant. We actually require direct observation therapy for those patients because we have to make sure that they're compliant and they're at that point kind of a public health risk. I'll tell you a funny story. In Washington State, there was a lady, this was a couple of years ago, who was diagnosed with active tuberculosis, and she refused treatment. And so the public health department ended up having to get the police involved because she was, spreading, and they found her on a bus going to a casino.
Oh,
So, it's her right to not have treatment, but it's also not her right to expose her community. So she needed to be in isolation until she wasn't having symptoms.
sure. It's tough. And when we think about how the disease manifests, it's not just, a cold or something like that. This can be
Right.
multiple months on end, really trying to track down and eliminate that infection.
Yeah, absolutely. There's been cases, I've had patients tell me about stories where it took them 9 months to get diagnosed. They go through the whole rigmarole of, oh, it's RSV, oh, it's pneumonia, or it's something else. Or maybe they don't have pulmonary TB. Maybe they have it in their lymph nodes or their glands or their GI system. So it's a challenge.
Yes. So thinking about just the impact that TB has on individuals, whether it's latent or active, could you give us a little more information on how TB testing did or could have impacted these scenarios from both an economic and community health perspective?
Absolutely. So the CDC has a great campaign they came out with. It's called Think, Test, Treat. And the think part, there is a screening questionnaire that everybody, all the public health departments use. It's basically 3 or 4 questions that are asked. If you answer no to any of those, you're done, right? But if you answer yes, then the recommendation is you get tested, and the preference is to use an IGRA, an interferon gamma release assay, like QuantiFERON, because QuantiFERON doesn't react with a vaccine called BCG, which most of the world, people in the world have received. It's also highly accurate. It's very objective and not subjective, like our 120-year-old skin test that we've all had and worked through. And then if that test is positive, then they're going to rule out active tuberculosis through chest X-ray or sputum culture. But if they've ruled out the active disease, then you start treatment again once a week for 12 weeks. And here's the other thing that I find important as a nurse: we're always looking at the clinical aspect and having a lot of empathy for patients and their families. But as an employee, I pay taxes, you pay taxes, right? And so we have to look at that impact as well. And when you're treating latent tuberculosis, the cost to treat for latent tuberculosis is about $800 per person. But if it progresses to active disease, it's about anywhere from $25,000 to $42,000 for one person. And those cases are managed by public health, which is funded by our tax dollars. So not only does this have a human burden, but it has a financial burden as well to our society.
Oh, that makes sense.
Yeah.
So you mentioned the CDC, but I also want to talk about the World Health Organization.
Yes.
Globally, there's been significant efforts led by the World Health Organization and other organizations to reduce, or really the aim of eliminating tuberculosis, specifically in those high-burden countries. As we've discussed, the U.S. is clearly not immune to the risks of TB, but I'm wondering if you can highlight some of the efforts we're doing here in the U.S. to really combat the issue.
Absolutely. So there are a lot of great organizations out there that are working locally and regionally to raise awareness and provide education and raise funds to support screening, testing, and treatment. QIAGEN and DiaSorin also, I think, we work very well together, and we are kind of approaching this as a support team. And so we are working on right now a contact investigation bundle where we could help alleviate some of the need for public health resources like staffing. So we would go in and actually manage that portion of the workflow, which we have looked at cost studies and labor studies, and we can effectively save our clients about $35 to $50 per person that they're investigating by coming in and doing this bundle, we call it. The other thing, we were at a conference recently, and we got feedback from the TB controllers across the United States. And some of the feedback that we received was they used to have funding for targeted TB testing to be very proactive instead of reactive, and they've lost that funding. Surprise, right?
This year?
Yes.
Oh, no.
No shock to anybody. So we're trying to figure out a model that we can come up with, to maybe find grants or partner with them to get back in the routine of being proactive about this in the communities.
Absolutely. Gosh. And when we think about that, there's other areas of the U.S. maybe we could spend our efforts on primarily when we think of border towns or those high international travel hubs.
Yep.
Any suggestions of what we can be doing in those areas for our local laboratories?
Yeah, I think just making sure that we're being culturally sensitive to that population. There's a lot of fear today with ICE, and there's a lot of fear not knowing English or not having funding or insurance, and just being sensitive to that and helping them understand that this is okay. There's nothing wrong with you. I had a cousin recently who taught English in India. In India, the prevalence of TB is astronomical. And she was saying that it is just assumed that everybody's walking around with latent TB because there's not enough staffing and funding to be proactive, so they're being only reactive and treating the active cases. So if we look at that circle, it's very vicious, right? If we're not being proactive and catching it, it's always going to progress, and we're never going to get rid of it. So helping those members, that specific population, understand that it's okay. It's not okay to have latent here in the U.S. We're willing to help you and treat it.
Absolutely. And so as we think of other maybe better funded areas, we have occupational health, right?
Yes.
Large employers
Yes.
that are also trying to protect their workers. Anything you can share there of things they should be thinking about as they look to screen for latent TB?
Yeah, I think employers sometimes think of this as a cost burden that they don't want to bear when they're screening employees, and they really should look at it from a risk management perspective. There was a large organization, I'm not going to put names out there, in Europe recently that had an outbreak, and the employees actually went to the union and are suing this company because they didn't feel like they had protected them enough. So I would encourage employers to step up and help be preventative. This is an employee benefit that is also a community benefit.
Sure. And I think across our organizations, there's teams dedicated to supporting those organizations.
Absolutely.
Through this.
Absolutely, yeah.
Great. Okay. Well, I'm looking at our clock. We have just a few minutes remaining. I wanted to see, Doreen, is there anything else that you'd like to leave our listeners with today?
Yeah, I would just like to encourage you to don't be afraid. Go out, answer those questions, get screened, and if you need to take a test, it's very, very simple, and just find out. I just encourage you to find out and be safe and keep your family and community safe.
Wonderful. Well, Doreen, it has been an absolute pleasure. Thank you for your time today and really seeing your passion come through, really looking to empower healthcare personnel in the fight against TB. It's never been more relevant with even the cases we have here in the U.S. today. To our listeners, stay tuned for more live recorded podcasts from Anaheim, California in the coming days. Thank you so much for joining us.
Thank you.